Hello, Dr. Kevin Connors for your Member Minute for today. Today we're going to talk about cancer and alkalinity. You read a lot about acid, alkalinity, and cancer, and that you might have read that cancer can't grow in an alkaline body, so we need to alkalize our body. And that's the problem. We're acidic. That's why we get cancer. Well, I beg to differ with that just a little bit. No, that might be the truth, but the problem with cancer is three things, remember. One, apoptosis is not taking place. Apoptosis is normal programmed cell death. That's what's to take place. When a cell replicates, the mother cell dies. That lives for a period of time, replicates. We won't get into that now. Second thing is replication. So replication is accelerated. So if I have a cell line that isn't going through apoptosis and it's in rapid replication, that is cancer. The third thing is that the immune system has to be diminished, because in order for somebody to get cancer, they have to not have an immune response against that cancer. So this happens in all of us. It's happening in me right now. If I have a healthy immune system, this is cleaning it up and keeping it at bay. The immune system kills things, and it kills growing cancer cells. However, we're not talking about that today, but you need to have an understanding of that to understand what I'm going to say next. So cancer is this cell line that is replicating and replicating and replicating and replicating and replicating and replicating and getting bigger and bigger and bigger and bigger and bigger. Now normally your cells replicate every few days to every 6, 12 weeks to a year. So they don't replicate very fast. So let's say, use my liver as an example again. It replicates typically about every 6 weeks. If it's in a cancerous state, the cell is in rapid replication, so cancer is growing, it might be replicating 6 times a day. The act of replication gives off a lot of waste. So normally in my body, my liver cell is replicating another cell, and then this cell dies. Well, the metabolism that goes on inside this cell gives off waste. That waste goes into the space between the cells. There's all sorts of cells here. That waste between the cells is called the extracellular space, or the extracellular matrix, because it's not really a space, it's occupied by fluid and waste. This waste is acidic. Well, that's not usually a problem, because you have these things called open-ended capillaries here that drain back to the veins and drain out of the body, called your lymph system. So your lymph system is kind of like a storm sewer. So the storm sewer picks up all this waste. It flows out here because you went and exercised today and moved the fluids through your body, and all this waste goes through here and it gets out of your body. That's great. So that's what happens normally. But in a cancer patient, this is replicating really fast. So we have this cancer cells that are replicating. It is building up this acidic slime layer of waste around this growing mass. The lymphatic system can never keep up with it. It can't keep up with it. So we got this acidic slime layer that is the waste of the cancer cells that also act as the protective barrier. So then I have my immune system. So let's say now I get healthy and I'm eating right and I'm trying to do the right things and my stress is gone. So I have a macrophage that's trying to go and destroy that. Well, it can't penetrate this slime waste layer, and it can't even get in there to kill it. So does cancer grow in an acidic environment or in an alkaline environment? Well, cancer really creates an acidic environment. So is it still good to alkalize myself then? Absolutely. You want to alkalize yourself. You have to alkalize your tissue. That's one of the benefits of the Rife. The Rife is using a light wave. A light, it carries a photon on the wave. That's what a true Rife does. It's a light wave that's hitting you at the frequency of the cancer. So it's attacking the cancer with a light wave. The photon acts as an electron donor. What does an electron donor do to tissue? It raises the pH. You're alkalizing the cancer. That's one of the reasons why the Rife works. You're alkalizing this. You're breaking this down so this lymphatic, this this white blood cell response can get in there and start killing the cancer. That's what we're trying to do. So this acidic slime layer has to be broken down. That's why you use things like enzymes in medicinal mushrooms and all the things that I write about in my book, to try to get in there, to break that down, to get in there and kill the cancer. That's what the rife does also. So cancer only does not grow in an alkaline environment. Well, that's not really true. Cancer creates an acidic environment. So it is true you want to alkalize yourself. That's why you juice and you use enzymes in vegetables and all this kind of good food that you're trying to eat. But it is, don't mix up that terminology.